Obamacare, the Affordable Care Act implemented in 2010, is now in full swing. But is it the success the President of the United States would like us to believe? Joining me down the line is health economist Jane Sarasohn-Kahn. Well, Jane, the Affordable Care Act, is it affordable?
Well, it's in the eye of the beholder, affordability. The one big thing the Affordable Care Act did was to cover people who had been refused insurance before with pre-existing conditions. And if you live in the U.S. and you have a pre-existing condition, you would likely have fallen into financial ruin if you got sicker. Health costs are the number one cause of bankruptcy in the United States. If you're young, however, and don't perceive any health risks, it seems quite unaffordable, and you might take the risk of not being insured or being self-insured and take the penalty.
Where's the money coming from to cover the extra people?
You're right. So it's $934 billion. Almost half of that comes from cuts or moving Medicare monies from one pot to the Affordable Care Act. Some of that moving money from our Medicaid plan, that's care for lower income American health citizens. Also the penalties for employers and individuals who do not get insured. And finally, revenues from health plans, medical device companies, and pharmaceutical companies.
It's estimated that around 30 million still don't have coverage at all. What happens to them, and wouldn't it just be cheaper if something does go wrong for the government to cover them from the beginning?
It is a political will question. We have not had the conversation in the United States that Beveridge had in your country in the 40s when the NHS was established. We really don't believe in healthcare for everyone in the U.S. If you look at our Congress, there is not consensus about that. As a health economist, my arithmetic tells me that it would be cheaper, absolutely, to cover people with a basic health plan. And that conversation, I think, will happen in the next year, 2 or 3, as more Americans are paying more out of pocket and understand the true costs of health care.
So what problems has Obamacare alleviated?
There's more prevention covered now. There's more mental health benefits covered, which typically have not been covered. The ACA also mandates that prices are not different for men versus women and for the sick versus the not sick. Finally, it's starting to drive down the big problem we have in the U.S., which are racial and other health disparities between rich, poor, Black, white, Hispanic.
People are still opposed to it. Is that purely politically motivated then? And what alternatives are they calling for?
President Obama has really created a whole new level of vitriol between people who don't like him and people who do like him. However, the ACA naysayers haven't offered a real comprehensive solution, except for maybe health tax vouchers, premiums, as they've done for schools. But that really doesn't solve our problem of high-cost health care.
A big concern when it came out was that it would cost a lot of jobs. Has this been the case?
We've had consistent job growth over the last couple of years since the ACA has kicked in. In fact, last week, a Bloomberg review came out in Bloomberg News, and they looked at a poll of employers in the U.S. asking that very question, and it was kind of a big corporate shrug, like, so far, it's not made a material difference.
So the goal was to get 6 million uninsured to be insured, but the cost of businesses has definitely increased to accommodate the rising cost for those uninsured. So has the incremental cost to mid to large size businesses thwarted growth a bit, or at least delayed economic recovery or growth in the US?
It's really hard to parse out the direct effects of the ACA on economic growth. For now, we're seeing the lower costs of energy, improving consumer spending. We're seeing home sales going up. We have a lot of positive indicators now, but again, hard to parse out the impact of these insureds, newly covered, and the ACA impact on economic growth. So I'll say the jury is out on that so far.
Up until Obamacare began its enrollment, American healthcare was run by multi-million-dollar private companies who sold health insurance policies for the most amount of profit they could make. What's happened to the insurance industry now and the knock-on tax effect?
If you look at the insurance industry, the big players, the big national players, United, Aetna, Cigna, Humana, many of the Blue Cross plans like Anthem, the profits are quite healthy. from 2014. They've been living large based on the ACA new enrollees volume going up with these newly insureds. And it's good to remember that the ACA was written heavily in parts by our insurance industry lobby, AHIP, and the pharma industry lobby, PHRMA. Now, the pharma industry isn't faring so well, not necessarily due to the ACA, but the insurance industry has benefited from new volumes of people coming in.
So overall, Obamacare, has it cost the US or saved it money?
Hard to say. Early days right now, and we are spending upwards of $900 billion on it. We do have to solve the problem, which the ACA does not solve, of lowering the costs of care and changing workflow and how we deliver care in America. That's not in the ACA. However, the private sector and the way we're starting to pay more on the basis of outcomes versus volume, that is paying for everything we do, is going to shift that. So I'd say call me in a couple more years and I'll answer that question.